Hello, hi. My name is Associate Professor Dr. Mas Ayu Said from Department of Social and Preventive Medicine, Faculty of Medicine. In this video, I will continue the lecture for module Essential of Public Health, and this week 7, I will introduce you Epidemiology of Concepts in Epidemiology. There are 3 subsections for this lecture, mainly Basic Concepts in Epidemiology, Change of Transmission, and Spectrum of Disease. Let's go through the first lecture. The first lecture, the outline, are mainly Model of Disease Causation and Epidemiologic Triad concepts. The definitions of epidemiology is the study of the distribution and determinants of health-related states in specific populations and the applications of this study to control the health problems. There are many models to illustrate disease causation. I will highlight 4 main models of disease causation, which mainly the epidemiologic lever, the wheel, the web, and the epidemiological triangle or triad. The first model is epidemiologic lever, mainly consists of hosts, which is human, agents, the microorganisms, and they are located at the opposite ends of a hypothetical lever. The environment will serve as fulcrum. In this diagram, I will illustrate the epidemiologic lever at equilibrium, and the host and agent are both located at the end of the lever. The environment serves as fulcrum, and therefore, any changes in characteristic of agent, host, or environment will lead to disease. When there is increase in the agent ability to infect a human, it will cause a disease to the host. And when there is increased proportion of susceptible hosts, it will also lead to a disease. When any environmental changes happen, it will facilitate agent spread. And therefore, in conclusion, disease will occur when changes in the ability of agent to infect man, when there is a changes in the proportion of susceptible hosts to population, or due to environmental changes. The next model is the wheel model, whereby the human organisms and the genetic codes are embedded by biological environment, physical environment, chemical environment, and social psychological environment. The next model is web of causation, whereby this web will show the interconnected factors which lead to a disease. For example, in lung cancer, it can cause by smoking, and it can also cause by occupations of a person. And in this web, it illustrated smoking behavior can be interconnected with an occupation of a person, and both can lead to lung cancer. The last model I'm going to show is epidemiological triangle or triad. It consists of agent, host, and environment, and any changes in one of these elements of the triangle can influence the occurrence of disease. The first element of epidemiologic triads is agent. It is a very important entity, can cause a disease to the susceptible host. The example of agents are biological, such as bacteria, virus, or parasites; physical, for example, radiation; or physical forces that occur in motor vehicle accident; chemicals, such as pollutants or drugs; nutrients, such as nutritional deficiency. The characteristic of the agent to cause a disease illustrated by infectivity, whereby it has the ability to invade a host, which cause a host to be infected or susceptible. Pathogenicity, which is ability to cause a disease, and it will manifest as clinical disease and infected. Another characteristic is virulent, whereby the agent has the ability to cause severe disease or death. The factors affecting infectivity are mainly dose, route of entry, and the immunity of the host, which later leading to subclinical infection. Host has been defined as person that is susceptible to be infected by the agent. The characteristic of the host, which is very important to determine whether they are susceptible for the infections, are genetic, specific immunity, personality, which is the behavior, and the socio-demographics characteristics such as age, sex, ethnicity, occupation, and social class. The infectivity, pathogenicity, and virulence of the agents are all depends on the condition of the host, such as immunity, whether active immunization or passive immunity that they have obtained, nutrition, adequate rest and sleep, and good hygienic practices. Environment in epidemiologic triad has been defined as conditions that influence the interaction between agent and host. For example, biological, physical, the climax, and physical surroundings, or social, which is related to socio-economic condition of a host. Environmental conditions may lead to major influence on health status of individual in the population. Any conditions below, such as famines, war, poor housing and poor sanitation, etc., may affect the pathogen ability to survive outside the host, and definitely it can cause transmission from host to host. In this slide, I would like you to explain how does epidemiologic triad concepts may influence dengue fever in terms of host, agent, environment, and the vector. To conclude this lecture, the basic concepts of epidemiology, I have highlighted the definitions of epidemiology and the model of disease causation, mainly the epidemiologic lever, the wheel, the web, and the epidemiologic triangle or triad. Thank you very much.